especially hard if you're an elderly person. Now a new program is aimed at brightening those dark days. Dr. Roland Rayner with Health Texas Medical Group is here to explain. Good morning, Dr.
Good morning.
Rayner.
How are you?
Thank you so much for being here. I love that we're talking about this topic because when you think about the elderly, those are our grandparents and our elderly aunts and uncles. And talk about the trend of depression as it relates to elderly people in this community.
Well, I tell you, it's so common. It's funny because you talked about one of the reasons about not getting out of bed this morning. The fourth reason is depression. It's really almost an epidemic. It's estimated that about 17 to 37% of people of geriatric age over the age of 65 have clinical depression. I mean, that's amazing. Not only is it not really recognized, it's not properly treated. And these people go ignored, which is really the worst thing that can happen.
I think, can you say, Dr. Rayner, that a lot of it is attributed to the fact that once you lived a long life, you start to experience more loss, and with loss come grief. You lose friends, you lose loved ones, you lose maybe a spouse.
Absolutely. Those things are very, very common. But I think what's important is that you keep people involved. You get them to live for something, because when they stop living for something and they stop taking care of themselves, the depression gets worse.
What are some of the signs that an elderly loved one is really having a tough time?
You know, depression can be a little bit different when you compare to a young person to an older person. The hallmark of depression in an elderly person is social isolation. They don't want to get out of their house. They don't want to move around. There's something called anhedonia, which is a loss of pleasure of doing things they used to like to do. So when you look at somebody and look at them, are they getting out of their house? Are they doing things? Are they gardening? Are they shopping? Are they doing things that they always used to like to do or not? And if they aren't, you need to think about it. A lot of times we think, well, they're just old. That's not the case.
No.
They can continue, and they should continue to live.
And do you find, Dr. Rayner, that a lot of times the elderly, they don't want to tell their family because they don't want to worry them?
Absolutely.
Yes.
You know, particularly when we deal with the elderly population, people over the age of 65, there's a stigma still associated with depression. You know, nowadays people don't have any problem saying, yeah, I take Viagra. Somebody says, I take Lexapro or Zoloft. But, you know, the older person doesn't want to admit it, and they don't want to burden their family. So that's why it's so important that we're aware of it.
And how do you reach out to them? How do you say, no, I want to be involved. I want you to get better because I care about you?
Well, that's one of the things that we're trying to do by getting people active. We have an exercise program, something that's associated with our Secure Horizons population. It's called a New You program.
Yes.
We have an exercise program where they actually have a free health club membership. So we're getting people who haven't exercised in 15, 20, 30 years. They're going out. They're working out 2 or 3 times a week. They're feeling great. It's amazing how something as simple as exercise can make a big difference. Having them to have a better self-esteem, weight loss. We have a nutritional counseling program as well that's been very effective. And then we have something else where we have discounted services for a cosmetic spa. So they're getting facial procedures done. You know, something simple like having a mole that's always kind of bothered you. You know, when they can get that removed, they just feel better about themselves. It's amazing how something so simple can make a big difference.
Right, and not only that, they're out and meeting other seniors like themselves. You know,
it's funny because as people get older, sometimes they kind of isolate themselves from the world. But when you give them a purpose for themselves, their family, to make an importance in the world, it makes all the difference in the world.
Health Texas is a wonderful group of doctors. You all just received a very special honor.
Yes, we have 10 offices in San Antonio, and 80% of our doctors have been voted the best doctors in America, which is unusual. It's amazing.
Yes, and you all have been in San Antonio how long now?
13 years now.
13 years. Well, congratulations to you and for doing such wonderful things for our elderly population. We love them and we want them to be healthy and well. Health Texas Medical Group of San Antonio, if you'd like to give them a call for more information, you can reach them at 731-4864. Dr. Rayner, thank you so much for being here this morning. We appreciate it.